Hello everyone, Dr. Sutter Caton, physical therapist here with Vive Health. I'm looking forward to sharing all my knowledge with you and I hope you enjoy. In this video, I'm going to show you a series of banded mobilizations, stretches, and exercises to help alleviate symptoms from a hip impingement. So these banded mobilizations are designed to provide you with a method of improving your hip range of motion that you can do at home on yourself. So normally these are techniques that I would be doing to a patient with my hands, so the bands are going to provide a way to recreate those mobilizations, and the idea is to create better spacing in the joint to allow that femur and the acetabulum to move smoothly and without allowing the hip impingement to occur. So I'm going to take my band, I'm going to place my leg through the band, and I want this band as high into my hip crease as I can get it. So I don't want it low on the thigh. It's not going to provide a good pull there. I want it right up as high as I can get it. I'm going to come away from the band so it's stretching directly behind me. And the first thing I want to do is just relax this hip and allow the band to glide, or imagine it's pulling that femur behind me in the joint. So I'm just going to kind of hang out here for a second and let it pull that. You might feel a little bit of a stretching sensation, not normal stretching as you're stretching a muscle, but kind of deep in the hip joint. That's good. So once I feel like I've let it relax a little bit, maybe 30 seconds, maybe a minute, I'm gonna then do a little bit of movement with this. So as that band is pulling me backwards, I'm going to rock on my backside towards my heels, and I'm gonna come back up. So this is sort of simulating the range of motion that the hip would go through if I was, say, doing a squat. So that knee is coming towards my chest and I'm coming back out of it. So typically, if someone has a hip impingement, at a certain point you may feel it pinch. We're gonna find where that area is and we're gonna try to stay just a little bit off of it. So I'm riding the line before I feel that pinch, but I want to see if after a few repetitions I can't sink a little bit deeper into that stretch. So I'm typically going to expect after anywhere from 10 to 20 repetitions to be able to sink deeper. It's difficult to put a set number because it may take more, it may take less, but what we're looking for as far as if this technique is effective is that you're able to get further range of motion without that impingement occurring. So the next mobilization is very similar to the last one. This time the band is pulling me in a little bit of a different direction. So we're gonna set up the same way. I'm gonna take my band, I'm gonna place it as high up my hip as I can. So I don't want it down on the thigh. This time it's pulling me directly from the side, not behind me. I'm gonna assume the same position on my hands and knees. And then we're gonna start the same way. So I'm gonna allow that band to pull me a little bit. I'm gonna feel a little bit of, might feel like the joint is decompressing or like you're getting a little bit of a stretch in the joint. So it should feel like a pretty good sensation. Once about 30 seconds or a minute has passed, I'm gonna do just like I did previously. So I'm gonna rock back my backside towards my heels, basically bringing me, you can imagine, into a squat if I was upright. And then we're gonna come out of that. So we're gonna do that about 10 times. If you're experiencing pain, just don't sink as deeply. So if at a certain point everything feels okay, but I go a little bit further, I feel that pinch, we're just gonna back out of it and not work so far into that zone again. So typically, after anywhere from 10 to 20 repetitions, I would expect to be able to sink even deeper, and that's a sign that this technique is working. So the next banded mobilization I'm gonna show you is a little bit more advanced. I would start with the previous two and then move on to this one because this one combines a little bit more range of motion, so it's not the first one I would go to. So once again, I'm gonna grab my band. This time you're gonna be on the back. So I'm gonna place my leg through the band. Once again, band goes as high up the hip as it can. I want it pulling me mostly to the side. I'm gonna lie on my back. The leg's gonna be up in the air. If the leg gets tired, you can support it with the hands. That's okay because that's not the main objective of this exercise. The main thing is letting that band pull the hip, and as it's held up like that, I want to add internal rotation. So what that means is my leg is rotating so that the foot goes outwards, because this is typically a problematic range of motion for someone with a hip impingement. So by having the band pull and create a little space in that joint, you should be able to move that hip a little bit better than you could otherwise. You can also bring the knee into even more flexion. So I'm bringing that knee even closer to me, and I'm rotating the leg out. This one I wouldn't hold for a long period of time like the other ones, because it can be hard to relax in this position. I would just go straight into performing 10 to 20 repetitions and seeing if you can't get a little more range of motion, either from the rotation or from the hip coming higher. So the next technique I'm going to show you is a stretch for the hip, working the hip into internal range of motion. So I'm going to be on the ground here with my legs out, and what I'm going to do is allow the side I want to stretch, I'm going to allow that knee to come towards the floor. So you should feel at a certain point a stretch in the hip as you lower that knee towards the floor. Don't go so far that your entire body is rolling over, because then you're defeating the purpose of the stretch. I want just that hip moving. Shouldn't take much before you feel that stretch. So once I'm there, I'm going to try to relax and sink into that stretch. I'm going to hold this no less than 30 seconds. I'd work up to a minute, maybe even a little more if you can tolerate it well. If you, after a minute, kind of gets stiff or gets painful and you want to come out of it, you can come out of it, but I'd recommend you go back. We want to work up to maybe 2 minutes of total stretch time, even if you have to break that up. So I'm stretching. If you feel like you need to get a little bit more stretch, you can take your other hand, and I'd start with just using the weight of the hand to provide a little bit more stretch. I wouldn't go pushing down on the knee too much. I would just let the weight of the hand and the arm provide a little bit more of a stretch. So this next exercise is hip internal rotation from a seated position. So it's a great way, once again, to work on that internal rotation of the hip that tends to be lacking and problematic when you have a hip impingement. And also just a good one to do if you're lacking that range of motion, even if your hip otherwise feels fine. So I'm gonna take any sort of firm object that you have around. So a foam roller works great, a yoga block works well, even like a volleyball or something roughly that size. Not too important. I just need something between my knees of maybe 6 inches that I can squeeze against. So I'm gonna place the object between my knees. I'm gonna pinch it fairly firmly, and then maintaining that pressure, I'm going to rotate my leg out into that internal rotation. So I cue people with, imagine you're rotating your foot out, but what I really want to imagine, I'm really trying to work on, is my hip. So if I had sort of a line drawn on my hip here as I went, that line would rotate in, is the motion that we're really going for. Be conscious of what you're doing at the ankle. I see a lot of people sort of torque the ankle weird, and there's no real reason to do that. Their body thinks they're getting more rotation that way, but really you're just faking it. So try to keep the ankle somewhat relaxed, pinch your object, and go out. You can even hold the in position for a second or two, and then come back. This is one where, once again, it's not too tough on the muscles. I would want to work higher repetitions to really try to improve that range of motion and control over that range of motion. So I may perform this up to 20 times. It's another one I like to do throughout the day to make sure we're getting that motion throughout the day and not just kind of one time and then we're set for the day. So I would do this 2 rounds, 20 repetitions every day. I hope you found the video helpful, and thank you for watching.